So the first gap I found is really just providers even knowing who is eligible for genetic testing. At the time, even the family history data collection process was a major barrier because even if you use me for an example, I have over 30 first cousins. And if you were going to interview me about my family structure or family history, that would take the entire visit. Providers even knowing who is eligible for genetic testing or even starting that family history conversation really wasn't scalable. So then I'd say the second problem, so let's say they are actually gathering family history and they're understanding a little bit more about who meets criteria for genetic testing. The second problem was actually getting access to genetic testing. The traditional model of genetic service delivery requires a provider to identify and actually refer that patient to a genetic counselor. But I was just even looking over the most recent NSGC professional status survey. And right now, there are less than 1,000 adult cancer genetic counselors that are available to provide direct patient care. And on average, they see less than 10 patients a week. So even if you are good at identifying those patients who meet criteria, the next bottleneck or gap is getting those patients in to see a genetic counselor.